Domestic violence is something that tears families apart, leaving physical and emotional wounds. There's a program at Gandara Center to educate men with a history of domestic abuse and hopefully break the cycle with group therapy. Carolee McGrath sat down with Gandara's Clinical Director of Outpatient Services, Audra Wynn, to learn more.
This is a state-certified program, formerly known as Batterers Intervention Program, is now called the Intimate Partner Abuse Education. This is a psychoeducational program that works with specifically heterosexual men who abuse women, intimate partners of present or past, physical abuse, emotional abuse, financial abuse, any form of controlling a partner in an abusive, unhealthy manner. These are clients, men who have been brought forth by the criminal justice system, and they are mandated to our program by a judge, by the probation or parole departments, through the court system, and or by the Department of Children and Families, who might ask them to work in this type of program if that's part of their service plan, if they're involved with the Department of Children and Families. So those are the two main referral sources that would bring clients forward to this type of program.
And what kind of setup is it? Is it like a weekly session? Is it like sort of group therapy?
So the psychoeducational groups are 2 hours weekly for a minimum of 40 weeks to complete the program. And that's by regulation for 40 weeks. And it is in group format. In very extenuating circumstances or special circumstances, it would be individualized. We can do that. But it's primarily in a group. That's where the evidence-based model comes from, is working in a group together with facilitators who are certified domestic violence counselors and have had extensive training in how to deliver this psychoeducational model.
And why do you think a group setting works when you're talking about somebody who has been the abuser, would you say?
It works because it's about behavior change completely, but it's also about accountability. And the way that groups work so well when working on behavior change is that there's a mutual aid factor that comes in. So if we're discussing my issue and the struggles that I've had with it, and my neighbor or someone across from me has dealt with something quite similar, that hooks someone in to be able to start thinking about their own selves, but then also cues that person into the behaviors that you're discussing that are maladaptive or unhealthy and abusive, and helps people sort of hold each other accountable for that change.
Okay. And some people might say, gosh, this sounds great. This sounds like a really nice attempt to change somebody, but can somebody who has this behavior really change? How would you answer that?
That's a good question. I can't speak for everybody who goes through the program, of course. But it has been shown over the years this is why I think the state certifies these programs, right? Through the lower level of recidivism when it comes to these kind of charges, that it's very helpful in working someone's behavior change, about creating an awareness that might not have been there before. It is a program that someone has to fund themselves. It is something that they have to, it's not covered by insurance. It's not a behavioral health problem. It's a person problem, it's a you problem, right. And so because it's a public health issue, of course, so the Department of Public Health sees it that way, the Commonwealth sees it that way, so it's not something that is covered by medical insurance or something like that. This is something that someone has to take full ownership of when they're working on that issue, and so there's, I think, a level of commitment that comes with that. And so the level of recidivism, I don't have the exact data in front of me, but is lower when someone goes through the program.
Because some, I'm sure, and I don't have the data on this, but I'm sure many of these men might have witnessed abuse when they were little or had been abused themselves. Is that something that would come up in group therapy?
So that can come up in the groups, of course, but when it comes to the behavior change and following the model for this group specifically, when someone gets into a place where they're talking about why they're doing what they're doing, and for any reason placing some level of blame somewhere else besides their own actions, that's redirected. And if a facilitator, for example, sees that someone needs maybe additional support, like individual therapy, a different level of group therapy that might be useful to them in their own process, which we provide at our center, they will suggest that to them. They'll make a referral for that service, and the person can engage in all types of intervention around that. But in the group, the psychoed group itself, there's no room for blaming or placing responsibility on the behavior somewhere else. It has to be within the person.
So that's an interesting way of dealing with it. Obviously, something that I'm sure is welcomed by a lot of people. But you can see how somebody would say, well, this is how I grew up. I grew up watching this. Mm-hmm. So there's no room for that. There's no tolerance for, okay, you had a bad childhood, so now you can return the favor on somebody else, right? That's just not accepted.
There's room to hear what someone has to say, of course. And it's not accepted as a reason that someone would do that when it comes to making actual change. Understanding the root of why something is happening is very important, and it's not a reason to keep repeating the behavior or to justify the behavior. So there's no room for minimizing or justifying. It's about taking the full ownership and learning how to move forward, unlearning the abusive behavior and learning positive relationship skills, social skills, anger management skills, all of that. But it's different than just anger management therapy because it's specific to intimate partner relations.
Okay, and what have you heard from the men who have gone through this program?
Well, of course, I can't say specifics about what they say. It's confidential. But I think overall and on a state level as well, like I said before, we do know that the evidence shows that it's positive. The impact is positive in discussing what someone takes away from that. In general, we don't see like massive amounts of people repeating the program in our center. So that's a good sign, right, as well. Sometimes people do. They might come back for a second time. They might have started and then not finished for some reason or another. Maybe they chose to stop. Maybe they had a different criminal case that they had to deal with and they come back later. So, we work with people on an individual basis in that way. But there is always a takeaway of how to, change behavior, how to unlearn the abusive behavior and change behavior moving forward.
Okay, and you also have other domestic violence programs as well at Gandara. Can you tell us a little bit about that?
Sure. So that program is psychoeducational, as I mentioned, but then we do have group therapy that's open to everyone, not just these clients, but to whomever. Particular to the criminal justice mandated clients, we have sort of the traditional individual therapy, substance abuse work, anger management that's more generalized anger management. We work with sex offenders who are accused and adjudicated with sexual violence cases. So we have a myriad of services, group and individual, that are open to people who've gone through the criminal justice system or are currently in it.
For people who are watching this, who have had, domestic violence situations in their family, obviously it's devastating. What could you say that would give them, hope that there could be a change, with such therapy?
I think it very much depends on if the survivor in the situation is wanting to stay with their abuser. That's very different than someone who has decided that the relationship will not resume during or after someone is in our program, because that varies, right? So someone that's in the program doesn't necessarily, get to be back with their partner who they abused after this. Of course, that's up to the partner, that's up to the survivor of the domestic violence, how they want to work their change, their own process. So I would say that if someone is looking for general change and knowing that there's a place that someone can work on themselves in that way, take full accountability and ownership of their actions, that of course this program is a place to do that. If someone is looking for a guarantee, nobody can make guarantees. Nobody can decide how somebody acts while they're doing the program or afterwards. We can give information, we can encourage and facilitate an open space for change, but at the end of the day, every individual is responsible for their own actions.